Okay, well, good afternoon. My name is Kenneth Dickstein, and I'm going to interview a representative from the ESC Patient Forum. His name's Michael. He's Irish, and we're going to talk about living well with heart failure, and we're going to ask him about his story, and he's going to tell us. So, Michael, tell us, when did you find out you had heart failure? How did this all start?
Okay, well, my heart story started 8 years ago in October 2016, almost 8 years ago, when I was having breakfast with my children, and I was due to be on a late shift that day. I was working as a nurse manager in Ireland, and I felt a pain in my chest, and I started sweating, and I felt both my arms were tingling, and I was 99% certain that I was having a heart attack. So I almost immediately phoned 999, and within 15 minutes an ambulance arrived, and when they first came, they were joking with me because I looked like I do today. I didn't look like I was unwell.
How old were you?
I was only 48, and once they put, they said, "Michael, will you come with us to the local hospital, get you checked out? You know, you're probably okay, but we'll just to be sure." And then they put an ECG on me to see if you know, if there was anything more serious going on. And they discovered that I was having quite a major heart attack. The ECG was able to tell them that my rhythms were very bad, so and there was probably a blockage on my heart. Within half an hour, I was in a helicopter on my way to the Mater Hospital in Dublin. And when they brought me into the operating theatre where they were do more investigations, they said to me, everyone said, "Do you smoke?" You know, I was 48 years old. I was having a heart attack. They said, "You know, you smoke, do you smoke, do you smoke?" And everyone, I said, no, I don't smoke, I don't smoke. And everyone kept asking me this question. So anyway, they inserted a catheter into me, and they did what's called an angiogram. So they to see where the blockage was in my heart. And they identified that on the left side of my heart, the main artery was 100% blocked, and the one on the right was 90% blocked. So they did an angioplasty to remove the clot. They saved my life, basically, and they put 2 stents in, which keeps my arteries open. So I've got 2 stents in my heart. And
You had a heart attack.
they confirmed that I had a major heart attack.
So you lost a lot of muscle.
So because of that, because it was blocked for a couple of hours, part of my heart died. So part of the muscle in my heart died on that day, and
This is one of the most common causes of heart failure. It's called ischemic heart disease. It means your heart muscle doesn't get enough blood. And this is the real garden variety cause. There's lots of causes. But what you're telling us is about the most common cause, which is having a heart attack. And then what happened?
Well, once they saved my life and put the stents in, within about an hour I was recovering, and I was conscious all this time, and they said, "We'll send you back to your local hospital as soon as possible, Michael." So by that evening, they sent me back by ambulance, and I spent 7 days in a coronary care unit at my local hospital. And it was during that time that the cardiologist there actually told me that I basically have heart failure. I had
What did he say?
Have heart failure. He said, Michael, you experienced a major heart attack, and your heart was starved of oxygen for a while, so part of the muscle died. And he basically explained that every time your heart beats, it should beat 60% of the blood around your body. 60% of the blood around your body, each heartbeat.
You know, 60% of the blood in the heart should be ejected.
Yes.
Right.
So he said, Michael, yours is only 30% now. So half of your capacity to pump blood around your body. So you've only got 30. What's called your ejection fraction is only about 30 to 35, whereas it should be 60, about 60.
Yep.
So he said, Michael, that's why you now
Yeah,
have
you got
heart.
reduced. It's called HIF-ref now, reduced ejection fraction, the most common cause of heart failure.
So it was quite a shock. And when I, of course, you Google when you get news like that, you go on to Dr.
Sure.
Google, and I read information, and it was scary, because a lot of the research that was coming up was from the 90s, and it was like, oh my God, I've only got less than 5 years to live, and it was like, oh, this is terrible. And then I had to educate myself, and I realized that actually the research was old, and that thankfully there's a lot of treatment available now and devices.
So what did they do for you? How did they manage your heart failure? How did they start to treat you?
So initially I was started on a number of different medications, some for heart failure and then some related to the heart failure. I was put, for example, on a beta blocker to manage my heart rate, and I was also put on aspirin because I have stents to keep the stents clear.
You got a device, didn't you?
Yes, about a year after my heart attack, I had some complications due to my beta blocker, because the beta blocker, which is controlling my heart rate, it brought my heart rate too low, and it was around 35, which is dangerously low. And I was at work, and I was trying to write with my pen, and I couldn't I couldn't use my pen. I could hardly use the telephone because my hands were so cold. So I went to the doctor on call, and he said, Michael, you should go to your nearest hospital as soon as possible. And when I went there, they confirmed that my heart rate was dangerously low, and they kept me in for nearly a month because I had to, they decided I needed to have an implantable cardiac defibrillator, but I couldn't have it immediately. I would have to wait.
ICD.
An ICD. They said you definitely need an ICD because you're at risk of cardiac arrest and other irregular heart rhythms. So you really need this because this will protect you. But it's going to take a few weeks to organize it. So during that time, I stayed in the hospital, and I had that implanted in November of 2017. So it's just here, and there's leads going from the device to my heart, and it's set between 40 and 220. So it keeps my heart rate above 40, but below 220. Yeah. So it's between.
So
40
have you ever had a shock?
I've not had a shock, thankfully, in the 7 years, and it's great. It's a great comfort to have it because I know it could save my life. Yep. But it was funny. A couple of weeks ago, I had a call from my ICD clinic because I had been on holiday and I have a telemonitor at home beside my bed, and that monitors the device and sends the information to my consultant at Mater Hospital. And I had been on holiday and came back and had forgot to switch the monitor back on. And I keep active, so I had been at the gym. Yep. And had been active. And they phoned me and said, Michael, what were you doing on these dates? On the 8th of April, the 15th of April, I think the 16th of April. And I said, I'll have to look at my diary because, I can't remember exactly, and I'll phone you back. And then I phoned them back when I looked, and each of those days I had been doing some training. I'd been at the gym. Yeah. And they said, oh, that's okay because your heart rate actually went above 150 on those days. And we were just wondering, and they said, that's fine because it's good that you raised your heart rate in the gym because that's why you train. But we just thought there was something else going on and we just wanted to be careful.
Yes. Do you have a heart failure management clinic?
Yes, I really do rely on the heart failure clinic at my local hospital because they're the team that I most closely work with. I see my consultant at the Mater Hospital once a year, And then in between those visits, my heart failure nurses, they help me to manage my condition. So if I have any concerns or any questions, or if I'm worried about anything, I phone them, and I know them all by name. There's
Yeah.
a team of three
That's
of them,
great.
and they're always very supportive.
And these are heart failure nurses.
These are heart
right?
failure
Yeah.
nurses in the heart failure clinic,
Right.
and they really
They make a
provide
big difference.
They make a huge difference in my life. If they bring me in for appointments, if
Yeah.
they're concerned about me, and they liaise closely with my consultant at the Mater
So
Hospital.
they help to fine tune your treatment. I'm sure that all the drugs. How many drugs are you on?
I'm on regular medications, at least 6. I'm on heart failure tablets, which I've mentioned, like I'm on Entresto, I'm on Carvedilol, I am on another drug called Forxiga, and that is a medication that I was started on recently. And originally it was a diabetes. It is a diabetes medication, but they actually discovered that in patients with heart failure, it actually benefits patients with heart failure.
But you're living a pretty normal, rich life. And I'm wondering if you could kind of tell the people listening here, what have you learned about that? What has permitted you to kind of accept this and live well with the condition, the serious condition that you have?
That's a big question, Kenneth, but a very good question. First of all, I think that the term heart failure is unfortunate because it sounds like, it's the end of the world. It's a terrible diagnosis to
Give
get.
us a good suggestion. and
So
give us a good suggestion.
We need to
Yeah.
maybe think of a new name for heart failure. But the thing about heart failure is you can actually, and I'm an example, I hope, that you can live well with heart failure if you do the right things. And I've learned that I need to take my medication as prescribed, and I also need to eat well. I need to keep active and exercise within my limits, which is important.
Tell me about that. You have some, your exercise capacity must be somewhat reduced. So how do you live, how do you tackle that in your normal daily life?
So I go to a gym. It's not cardiac rehab. I did do some cardiac rehab, and it's a great initiative, cardiac rehab, as a stepping stone to getting back into exercise. So I started off with cardiac rehab, and then I started a normal gym. So I go to a gym, and when I started, I was only 48, 49, and I'm training with other people my own age, younger and more older, and there's a mix of abilities. So
Sure.
I always explain to the trainers, I always tell them, look, I actually live with heart failure. I've got a device, and I can only do so much, and I work within those limits. So, but I'm able to do a lot of what other people are able to do who are my age.
Yep.
And the thing I say to people is that when you have heart failure, your heart is damaged and it's weak. So it's important that you look after the rest of your body, because you have to support your heart, because your heart
Yeah, I like
is
that,
not
yeah.
functioning 100%. So it's important to keep the rest of your body, for all sorts of reasons. And by keeping active and eating well and sleeping well and managing stress, and there's also the psychological side of it as well, because if you have heart failure, you could, for example, end up spending too much time at home, not going out, not being active.
So you have a son and a daughter. So how does that affect your family life?
Well, to be honest, I try and live as I did before. The main difference is that I'm retired now, so I have more time to spend with them and to look after myself. So it just means that I used to work as a nurse manager for 20 years, and when I was diagnosed with heart failure, I was given the option for early retirement. It just means that I can, life is still stressful, but when you have heart failure, it's important to pace yourself. So not to try and do everything at the same time. You need to spread the stress, spread the workload. So do things in a gradual way. And that's what I do. So I try not to plan anything that's going to be stressful.
You don't shovel snow.
Oh, I never shovel snow.
Yeah.
No, thankfully,
Hey.
we don't get much snow in Ireland. We get maybe a little bit compared to
It's a big problem
Norway.
in Norway. It's a big problem.
But when there is snow,
Yeah.
you know, I never shovel it. You know, yeah.
So tell me this. You know, we're very grateful that you're here. You're here at this Congress, and that you're a committee member of the Heart Failure Matters website. How important do you think? What are the ways that we can educate patients? This meeting here, this is all about for healthcare professionals. We're very good at educating healthcare professionals, doctors and nurses, but reaching out to patients, I think, is a challenge, especially when you're talking about a disease that has so many causes. And it's very different, whether you're talking about a kid with congenital heart disease or an elderly person with valvular, or the most common one, a person who's just had a heart attack. How can we better reach out to patients?
Well, I think there's a number of ways that we can do that, Kenneth. One of them is, for example, through our website and social media platforms. For example, the Heart Failure Matters website is specifically designed for patients with heart failure. So everything on there is designed for patients with heart failure, people with heart failure to read, to understand, and it's in a form that's very practical. And there's videos, for example, this video will probably end up on that website, and there's videos of other patients being interviewed and telling their story. And I think the more patients who tell their story and make it real, I think it will benefit other patients. But there's also a matter of increasing awareness among primary care, among our GPs. We need more heart failure nurses because they provide such a valuable service and they're more accessible.
Yeah.
And just getting people actually talking more about heart failure.
It's also getting people to know what can be done. You're a very good example of how you've benefited from this. Patients have to be a little more demanding. They have to know what's out there and have their expectations increased. Okay, is there anything, I think we probably have to close the interview. Is there anything else you wanted to say to someone who's out there listening who's just got this diagnosis?
Only that, if you have heart failure, it doesn't mean that your life is over. It just means that a new chapter has begun and you can live very well with heart failure if you make the right decisions and have the right support around you.
Oh, I love it. Okay, thank you very much.
Thank you, Kenneth.
Thanks, Mike.